So shall we get started while with our first speaker, who is Dr. Catherine. Now, she is a renowned dermatologist and key opinion leader who draws on a wealth of experience to assist in solving clients' dermatology concerns. Dr. Catherine specializes in all aspects of skin disease, including acne, eczema, psoriasis, skin cancers, skin rejuvenation, and acne scarring management. She lectures internationally and is a senior advisory consultant with world-leading skincare companies, raising awareness of skin disease. So, Dr. Catherine, if you are there, come on down.
Hello. Hopefully all the links are working. It's lovely to be with you.
And just like magic, she appeared. Wonderful to see you.
Yeah.
Wonderful to see you. So let us know what you're going to be covering today very briefly before I let you start with your wonderful session.
So really what I wanted to do, I think that when you start talking about skincare and how to manage all of these different diagnoses, it can be so overwhelming. So what I wanted to do today was to really just break it right down to some really simple steps that everyone can do. And it's something then that you'll be able to just start doing, and you'll see that amazing benefit coming through with your skin. And it doesn't matter what conditions you have, they'll be helped with some of the key things we go through today.
That sounds so beneficial. So wonderful. I hope you will enjoy this session, and I will join you later, Catherine. Thank you so much.
Thank you. So I've got a few slides to share with you. I don't want you to feel overwhelmed with what I'm showing in terms of the medical pictures and things like that, but I just thought it would be an opportunity to get you to kind of think about some of the different structures of the skin. So are we able to kind of load up the show? Right, okay. So what I wanted to run through was how can we all get our best skin? And one of the key messages that I always tell my patients is that sort of happy, healthy skin is always going to have an amazing glow, and it's going to make you feel so much better in yourself. So let's move on to the next slide. Now, you've heard a little bit about me, and I always get very embarrassed whenever I hear introductions like that. I've worked as a consultant dermatologist in the NHS and now privately, and it feels like a very long time that I've been doing this job. I love my job. It's a very, very big challenge because in dermatology, we actually have the most number of diagnoses. So we have to have a really wide range of knowledge. And what I'm going to run through today is actually, no matter what patients are presenting, we break down skincare to kind of pretty much 3 steps, and then we can start adding in a couple of extras towards the end of the presentation. So I've got a lot more information about individual questions about eczemas, dry skin, that sort of thing on my website. So I've just popped it down there for you if you're interested in doing a little bit more research or have any specific questions. Okay, so next slide. What I think it's really important to remember is that the skin is basically a marker of what is going on inside your body. And we can talk about what creams you can put on your skin or what ingredients you can use and what's important. But ultimately, if you're not thinking about your body as a whole, you're never going to have the best results. And I know that you're going to have some amazing talks today with nutritionists and other people who'll be coming to speak to you. And it's really important to remember that the skincare forms an important part, but it's just a small section of the things that you need to think about for your general skin health. And I've mentioned a few things there in terms of having a healthy diet, having exercise, managing stress, which, to be honest, I think can be really tricky for everyone, but stress can have a huge impact in your skin health. And we know that people will often come into clinic when they're having a really stressful time and their skin just seems to go out of control, whether it's with eczema or psoriasis or even acne. Now, no smoking I've put up there. We all know that this is never going to be good for your health and skin. So it's definitely high up on the list. And the other thing is thinking about sleep and how to actually have a restful night's sleep to allow yourself to feel refreshed. The problem is that if your skin starts to misbehave, this is something that gets kind of it becomes a really big problem very early on, because if your skin is itchy and uncomfortable, your sleep cycle really gets affected. And that can then have a negative effect. It kind of all plays in to creating a really, really challenging problem. So can I have the next slide? Now, whenever I start talking about skin, I have to put up a structure of the skin picture. What I want you to think about is that I always describe skin like layers in a sandwich, and you've got the waterproof layer on the outside, but there's a heck of a lot going on inside the skin. And the different layers of the skin will take a kind of, so there's a period of time where the skin cells work their way up from the bottom layer to eventually mature up and end up being the kind of waterproof dead layer of the skin, which is then sloughed away. And when we're younger, that whole process can take about 4 weeks. But then as we get older, the skin cycle tends to take about 6 weeks. So it's a much longer process. And this explains why sometimes you might not see the benefit of some of the treatments that your GP or that your dermatologist might be recommending for that kind of window of time. So it's just important to understand that the skin is a really active organ, and it's constantly rejuvenating itself, but that process can really be affected and slowed down a little bit with age. Now, we've got the layers of the sandwich, and as we go kind of deeper into the meat of the sandwich, we've got a lot of really important structural elements. And these are the things that make our skin look nice and plump and have a good elastic recoil. And these are things that we all really want to try to achieve. And there are a few little tricks with some of the new ingredients that we can really try to optimize some of those amazing proteins like collagen and things which keep our skin strong and healthy. Now, if I could have the next slide, as well as thinking about the skin like a sort of sandwich, like a waterproof layer, there's also an awful lot going on. And we've got an incredibly active environment of bacteria and yeasts, and something that we call the microbiome, which sits on the surface of your skin. And the microbiome can alter depending on where you live, whether you have pets, other people in your house. And it can also alter depending on how dry your skin is, or whether your skin tends to be a little bit more oily. And it can even alter on different bits of your body. So this microbiome that we all have kind of protecting and sort of sitting as an extra coating on our skin can vary, whether it's skin from your face, from your scalp, from your armpits, anywhere like that. So the makeup of that amazing population, it changes depending on where we look. The other really important thing to remember, and where my job as a dermatologist comes into play, is that there is also a very, very active immune system in the skin. Now, normally this would be doing a job to look out for any little organisms or something that's trying to break through that skin layer, or a trauma or an injury or something that needs to be repaired. But sometimes it can go wrong. And that's usually when you would experience things like eczema, psoriasis, or even acne. So these are the kind of common things that are starting to misbehave under the skin, but creating the problem that we see on the surface of the skin. Can I have the next slide, please? So it can be really, really overwhelming when you try to say, what can I do? This all looks really complex, Catherine. What can I do on a day-to-day basis to actually keep my skin healthy? So what I want to talk about is constructing that very straightforward skincare regime that you can do on a daily basis that you know will be keeping your skin in the best possible health. And whenever I see a patient in clinic, this is where we start. I need to know and understand what you're doing at the moment and what changes I can make to just kind of do a few little tweaks that might really help you be more comfortable. And the other thing to say is consistency. So when you find something that's working for you, don't be in a hurry to look for the latest ingredient or a nice gift that you've been given. When something works, you stick with it, and you have that kind of real approach that you're doing this for the best of your skin, and you're going to stick with it, and you're going to maintain it. Okay. And remember that 6-week skin cycle. So we need consistency in anything that we're doing to manage the skin. So if we could have the next slide. So, when it comes to dry skin or eczema conditions, I always describe the skin barrier a little bit like a broken down stone wall. And what's happening is that you've got this kind of crumbly wall and the cement in between the stones. It's just not working, it's not sticking. And that's creating dryness, itch, and discomfort on the surface of the skin. And it's also creating an opportunity for more organisms and bacteria to creep through the skin and cause infections. But it's also creating an opportunity where you might start to have things like allergens coming through your skin, and you can react to things that you may not have had a problem with in the past. And that can be things in your diet, and it can also be things in your environment, like pollens and things like that. So we start the skincare routine with really trying to think about what can we do to keep that brick wall as well supported and as structurally sound as possible. So if I could have the next slide. We start off with washing the skin. So normally when I ask patients, what do you use to wash your skin? It's not uncommon for people to say, oh, shower gels or a soap, a bar of soap. I've used it all my life. But actually, when your skin is vulnerable and dry, what we need to do is to think about something that's a little bit more clever than just soap. The problem with soaps is that soaps strip all those lovely natural oils from the skin. And they can also create an interesting problem with the acidity and the pH of your skin. So it can create a problem with that really lovely microbiome layer that I was talking about. So all those kind of nice, happy, healthy bacteria and bugs that are living on our skin in a really supportive way for our skin. So we need to think about switching from soap to something called a Syndet. Now, in dermatology, we love very, very silly words, but Syndet stands for synthetic detergent. And examples of Syndets that you can find in your supermarket would be things like Dove. So Dove body wash is a great Syndet. Some of the other Syndets are things like Sanex, and you may well have seen Sanex hypoallergenic or products like that. And also there are the other more conventional products, brands like E45 and Neutrogena and products like this, which are available really widely and at a really, really good kind of price entry point. So these are synthetic detergents. They're very respectful to your skin, and they're going to avoid any excess loss of oils from the skin. So they will clean your skin, but they're not going to over dry it. So that's a really good starting point. The next thing we need to think about is how can we create that sort of temporary cement to keep all of the skin cells together? And this is where we reach for moisturizers. Now, moisturizers are essentially all a mixture of grease and water to kind of lesser extents or to more extent. So if you've got a light lotion, these ones tend to have more water. And generally, people prefer using these during the summer months. And then in the winter months, we might want to reach for something a little richer. And the most rich would be an ointment where you've got a lot of grease and no water. An example of ointments would be things like Vaseline, or there's a product called Eucerin Aquaphor, which is a really kind of good, very thick moisturizer for people with very, very dry skin. Now, instead of just reaching for moisturizers that are either very greasy or very thin, what we can also do is to start to add in some clever ingredients. And some of the ingredients that are on the market at the moment can really help boost the kind of sensation of soothing and also improve that kind of plumpness of the skin. And these are things that we love putting on our facial skin because they'll also thin out any fine lines that might be there by giving you a lovely, plump, well-hydrated face. So the ingredients that we look for here, ceramides. Now, ceramides, lovely ingredient that makes everybody's skin feel great from the first time you get the product on your skin. So it doesn't take any work to kind of get up and running with it. And generally, these are really, really good things to look for if you have very dry skin or if you want to optimize the kind of moisture that you're getting in your facial skin for fine lines. And the other ingredient has a slightly strange name called hyaluronic acid. Now, a lot of people see the word acid in that name and you think, oh my goodness, I don't want to put an acid on my skin. But hyaluronic acid, the way I describe it, it's like a big fat molecule that loves drawing water into it. And it has many, many uses in dermatology and also in the aesthetics world. So you will have probably all heard about people who have fillers and injectables to kind of plump the skin. Now, these are actually based on that hyaluronic acid molecule. So what's happening is that you're injecting the molecule and then you're getting a kind of plumping effect because you're getting water drawn in towards the molecule. Now, you don't have to have this through injections, and there are lots of amazing face creams and moisturizers that have hyaluronic acid, which it's going to, again, sink into just the top layer of the skin, and it's going to draw the moisture into those areas that you want it to be. So it's going to, again, plump the skin, give you an appearance of much sort of lighter, fine lines in the skin, and it can really improve that kind of overall skin health. And it's beautiful for kind of round the eyes and places like that. Now, a few little words about hyaluronic acid. If you're using it in your skincare, remember, because it's drawing water to it, make sure that your skin is patted completely dry before you're using any hyaluronic acid. Otherwise, you get this sort of strange effect called piling, where it's almost like the product sort of sits on your skin and feels like it's peeling off a little bit. So the trick, if that's happening, is to make sure that the skin is really patted dry before you start using the product. Now, the final kind of pillar of our basic skincare sort of program is adding in a sun protection. So I spend a lot of my clinical practice looking after people with skin cancers and precancerous skin lesions. And we know that too much sun exposure on your skin is a really bad idea. And that's not just burning sun exposure, but it's also a cumulative exposure, which will happen throughout our whole lives. So it's very important that we're protecting against UV radiation. And UV radiation is made up of 3 parts. So it's very important that you understand the labels on your skincare, and that you're understanding that your product gives a good protection to all 3 bits of the light. So first of all, the SPF refers to the UVB. This is the nasty burning skin sort of damage from the sun. And it's something that's very important to protect against. So we say go as high as you can. And certainly I always ask my patients to not really go below a factor 30. So go for something like that, 30 to 50. And then we also need to think about the UVA. Now, UVA can also cause a lot of precancerous damage in the skin, but it can also travel very deep into the skin. And this is something that's responsible for causing a lot of damage to your collagen. It gives you a kind of aging effect on the skin. Finally, the blue light or visible light, this might be something that you may have heard about. And during lockdown, a lot of beauty journalists were talking about it as this kind of new thing that we all had to be worried about coming from our computer screens or coming through our windows. Now, this blue light is particularly important if you're worried about pigmentation of the skin. So if you're prone to dark spots and dark marks on the skin, it's something that you may want to think about adding into your everyday regime. And if you look for a clever sunscreen, often you'll find that it will have all 3 bits protected, and then you know that you're covered and you don't need to worry about it. So find a good product. People always ask me, what are the best sunscreens? There are so many different ones on the market, and I think it's all about what you can tolerate. And I'm a big believer in affordability for sunscreens. So the most important thing is that you're using products that you feel very comfortable applying and that you're using enough of it. So, I always say to people, the best sunscreen is the one that you'll use. Okay, so that's it in a nutshell. So if we move on to the next slide. So now what we're thinking about is, okay, we've got our really simple pillars and we can all do that. We can use a soap substitute, we can use a moisturizer, and we can add in a sunscreen. So that's your basic everyday regime. How can we spice things up a little bit? What are all these ingredients that we can always see the press talking about with, active ingredients and how to kind of anti-age or, reduce and rejuvenate fine lines on the skin? So what other things can we start to add in? So this is where our pillars start to grow a little bit. So let's think about some of those actives. Can I have the next slide, please? So this is the world of cosmeceuticals. Now, I still remember when I was growing up, you would see an advert on the television, and they would have something at the bottom of the advert when they were advertising a new face cream saying 9 out of 10 women like the product. Well, nowadays, this sort of stuff doesn't really stand up to scrutiny. We want to have a little bit more science behind it. We don't just want to know whether people like the feel of it. We want to know whether it's actually going to do anything, because some of these ingredients can become quite expensive. So if we're going to invest in them, we want to know that they're going to work. So this is where we move into the field of something called cosmeceuticals. And this is really the kind of growth of something called medical grade skincare. So rather than just giving a moisturizing effect or making the skin feel nice, what we're asking these ingredients to do is to penetrate into the deeper layers of the skin and actually have an effect in the skin that we can see and we can recognize, and have a little bit of research behind it to know that these things are helping with fine lines and some of the other things that people don't want to happen to their skin. So these are cosmeceuticals. They're different to things on prescription. And these are things which, as a dermatologist, I would prescribe in clinic. Cosmeceuticals generally are things that you're able to buy over the counter. But as the other kind of downside of that, we're asking for these molecules to do a little bit more, but often they can cause a lot of irritation and a lot of problems with people's skin. And if people overuse them or are using too many of these active or cosmeceutical ingredients, you can often have irritation in the skin. So it's not uncommon for people to come into my clinic with a long list of things they're doing for their skin. And actually, it's my job to stop them using a lot of these products and really simplify what they're using to reduce irritation in the skin. Can I have the next slide? So where do we add in these kind of, actives? Where do we want to kind of put them in our sort of simple cleanse, moisturize, sunscreen step? So there are often a lot of different ingredients. Some of them will be better in the morning and some of them will be better at nighttime. But if you're thinking about just adding in one new active product, I would always say use it at nighttime. That way, you're going to have the maximum benefit with the most application time to your skin without having makeup and other products and sunscreens and things that might be interacting with some of those ingredients. And we also know that during nighttime, it's a really good opportunity for those products to sink through the skin. So something about the kind of temperature and the way that your skin's working at nighttime, it likes to suck up those products overnight. So it's a really good time to add it in. So if I can have the next slide. Now, this is a field, it has exploded. So there's so much information out there, particularly online, and it can be so overwhelming. So what I thought we'd do is really just break down those active ingredients, and I'll talk about some of the most common ones. So then to sort of depending on how your skin's behaving, which one might work for you, okay? So retinoids or retinols, which are usually the form of it that's available over the counter and in your kind of chemists and beauty shops. This is a vitamin A derivative. And we know that what it does, it actually improves the sort of cell turnover. So it has a little bit of an exfoliating effect on the skin, but also it penetrates deeper into the skin. And it's very good with some of those structural proteins like the collagen that we were talking about earlier. And what it does, it helps to kind of thicken that area a little bit. And collagen is one of the key, when you lose collagen, you end up with sort of skin that feels thin and crepey and vulnerable to damage. And also it kind of worsens the sort of downward pull that we all get on our skin as we get older. So in terms of evidence base for the science behind an active that works, the best and most effective thing that you could use is a sunscreen. That's number one in terms of evidence. But number two in terms of evidence is a retinoid. And then the form over the counter is sort of 10 times weaker than the retinoids I use in clinic, and that's a retinol. But we still have good evidence that they help boost collagen. So in terms of evidence base, it's sunscreen, retinoids, and retinols. So those are kind of where we're at in terms of the science behind it. Now, there are other active ingredients that we can add in, and this is where the antioxidants come into play. So normally with an antioxidant, we tell patients to pop it on in the morning. think about it like a protection against pollution. And it's really going to help with kind of mopping up some of this damage that happens with sun exposure. So it's a really, really good, a bit like a skin repairer. And there are different forms of it. So the most common form out there is a vitamin C, but you can also have a slightly richer form, which is an oil-based one called a vitamin E. And if you have a look at some of the products that you've got on your bathroom shelf, you'll have a look for those two ingredients, and then you know that you've got the antioxidant ticked, okay? The other thing I'd add in there, there's an interesting product called resveratrol. Now, resveratrol is basically a compound that's found during the winemaking process. And what's really interesting, it has an antioxidant effect, but it also has a bit of an anti-inflammatory effect. And what it seems to do, particularly with sort of perimenopausal and menopausal skin, it can mimic a little bit of an estrogen in your skin, and it can actually help with the plumping and boosting of some of the collagen and the other kind of volume loss that you can experience after going through menopause. So resveratrol, from the winemaking process is a very, very interesting ingredient and something you might want to have a look at for your antioxidant. So let's now move on to the alpha hydroxy acids. It's not just alpha hydroxy acids, there's also beta hydroxy acids. These are the exfoliants or the chemical exfoliants. And again, you hear the word chemical exfoliants and you think, oh my goodness, I don't want to put that on my skin. But actually, it's a much healthier way of trying to slough off dead skin rather than using the old-fashioned things that we used to use, like scrub-based products or a kind of, flannel. So it's going to remove dead skin in a much, much kinder way to your skin. And there are a variety of different products on the market. One of the most common is an alpha hydroxy acid called glycolic acid. And you can often find these in face washes, in toners, or even in masks, which you can use at home. And if you have more of an acne-prone skin, so this tends to be with my teenage patients, definitely, but also increasingly with women in their 40s and 50s going through perimenopausal and menopausal symptoms, you can often end up with hormonal outbreaks, which will happen around your chin. So adding in a salicylic acid or a beta hydroxy acid can often be helpful here, because what the beta hydroxy acid does that's different to the alpha hydroxy acid, it can actually cleanse right down into the pore and remove gloop. So if you're someone who's got a lot of congested skin or perhaps a lot of prominent pores, you might want to look at introducing one of these chemical exfoliants once a week. So you don't want to overdo it, but you also want to have that benefit of kind of renewing your skin. So normally I say, think once a week for those sorts of products. Now, there are other products on the market, and there's a whole host of ingredients. We call these peptides or peptide stimulants. And this is where you have a lot of active ingredients that come from nature, and beauty companies are permanently looking for the next kind of holy grail out there that's going to really help with rejuvenation of the skin. Many, many different things on the market, niacinamides and things like this. So loads out there. But I think probably the key ones to remember are your retinols and retinoids, your antioxidants, and then your exfoliant acids. So if I can move on to the next slide. So I hope that's been helpful, just to kind of demystify a little bit of all this kind of crazy jargon that you can see in the papers and online about some of these ingredients. Whenever I see patients in London, because I take this so seriously in terms of getting the right steps for their skincare, one part of seeing me in a clinic is that we always do a full skincare check. And then I will kind of recommend products that they may find beneficial. Now, I'd like to open that up to all of you today. So we're going to have a little link which is going to come up, and that will take you through to my team and my skincare concierge so that you can answer a few questions, and I will actually be able to send you a personalized skincare recommended program. And I'd be very happy to put some advice out there, even if it's just that one hero product that you're after. But I'm very happy to try to help you on this journey. So thank you so much. Lee, should we go back to you?
Fabulous. That was such an insightful, wonderful chat, don't you think, everybody? I mean, I know a fair bit about skin, but I actually learned lots of things there. So thank you so much. The resveratrol, Really interesting. So did I understand it that you can get a slight lift in your estrogen? Did I hear that correctly?
Exactly. So the holy grail at the moment out there is looking for things to help women with menopausal skin. And the problem is that
Yes.
what happens, the big thing that happens to skin is that you have this dramatic loss of estrogens.
Mm.
And estrogens are, they're brilliant at two things. Okay. They keep your collagen plump so that
Mhm.
you've got that scaffolding and that structure in your skin, but
Yes.
they also help elastin in the skin. Now, that gives us that kind of lovely recoil that you get on babies' cheeks, where they kind of bounce back.
Bounce back.
And I
Yes.
know it's that bounce back in the skin. And unfortunately, as you lose the estrogens, you have a kind of hammering of your collagen and you have a hammering of the elastin. And then you end up with this sort of skin that just doesn't behave like it's been behaving before. And it
Yeah.
can happen quite suddenly. And I look after lots of women who've been on journeys with skin, with breast cancer and things where they're sort of pushed into a very early menopause. And it all happens very, very suddenly, and you've really got to kind of think about what can we use in skincare to help them with some of those really bad effects. I'm
Yeah.
sure there'll be lots more coming out on the market now. It's a kind of really positive time.
Fantastic. And so could you take resveratrol supplements as
You
well? Would
can,
that
you
also
can
boost?
absolutely, yes,
Yeah.
and similarly with the antioxidants, the other big thing in skincare is niacinamide supplements as well. So I recommend these to a lot of my patients who have pre-cancers on the skin or a lot of
Yes.
sun damage to try to help mop up some of that DNA damage in the skin. So that would be working throughout your body as well if you're taking it as a supplement. So long as you're doing things sensibly, and
Yeah.
that's the big thing, because as a doctor, we don't want you to do anything that could harm yourself. But there's good evidence that these sorts of things would be a safe approach and safe things to do.
Fantastic. Really valuable information. Lots of people in the chat saying you're a great advert for this talk because your skin's beautiful. So there we go.
Very kind. I was saying to you, Lee, I was like, oh my goodness, I was at a meeting yesterday and I didn't think I was looking my best today. So I think we all have our hang-ups, and I wasn't enjoying seeing my face on screen, but it's very, very kind of you to say that.
Oh, wonderful. So a few questions have come up in the chat, actually. So someone was just saying, my daughter has suffered from acne since she was 10. She's now 22. She has pockmarked cheeks. She's had treatments, antibiotics when she was 10 and 18. She was discharged from a dermatology clinic. She's left university. She's now home, but her skin gets worse with her monthly cycle. Have you got any thoughts on that?
Yes. So this is a really, really common way that I see women coming back into clinic. So look, the teenage acne that she experienced is something that happens to everyone. So this is part of normal physiology. So unfortunately, when you're a teenager, you get this huge surge in oil production. It leads to a lot of blackhead formation, clogged pores, and you end up with spots at the end of that cycle. And it can, some people will ride through it. Other people will really struggle with marks and scarring. And it happens at such a difficult time of their life when you're a teenager and you don't want to be thinking
Yeah.
about this. You've got enough insecurities. It's a horrible, horrible thing to have to go through. But as your skin and that oil production starts to kind of level out, sometimes what happens is that people develop a different type of acne. Now, what she has moving into her 20s now, this is actually what we call adult onset acne. And it's something that comes in all the time into my clinic. And people come in and go, oh my goodness, I don't want to go back to what my skin was like. Please tell me we can do something about this. So with the adult onset acne, the kind of key in the history, it's about this menstrual cycling. So we'll often have experienced these little breakouts that happen around the jawline area and the chin area, particularly before you have your period. And sometimes what we can do in kind of skincare, yes, we start with the basics, get the cleanser right, get the moisturizer right, get the sunscreen right, so you're protecting your skin. But then we can add in things like the retinols. And for some people, just cycling your skincare a little bit by using a bit more retinol during that time of the month, it can help. And I know because I've done this most of my life. So I will add in a little bit of a retinol serum around the time of my month when I know I'm going to have those breakouts. And that I find that really helps me.
Mm-hmm.
Now, if it's happening in a more severe way, you're then onto something that would be more prescription grade, and that would be a retinoid to try to reduce
Yes.
the oil production and the clogging of the pores that's happening. But there's
Yes.
also a very interesting treatment we use a lot in dermatology clinic, which is a tablet called spironolactone. And people in the community may have heard of this for blood pressure, but in dermatology, we use it for adult onset acne as a very, very low dose. And what you're able to do, if you have a very, very regular period, we can basically give you 5 days of tablets before your period starts, at a very low dose of spironolactone, and that will stop those breakouts happening. So it's working to actually block the effects of androgens, which are things like testosterone, which often cause these breakouts. But it's a really interesting drug. It's been hugely popular in the US, and increasingly, in the UK, dermatologists have been adopting it. But it's not normally something that your GP would be aware of if you speak to them. But there are lots and lots of options out there. In terms of the other bit to the question, so with the marks on the skin, this is something, so when I was working in the NHS, it always used to break my heart because we'd get the skin under control and we get the spots under control. But in the NHS, what you're not able to do very much for is the scarring. And that's the bit that it can be absolutely demoralizing for people. So there are options out there. And one of the best options is actually a technique called microneedling. And that can either be done by a dermatologist. So in clinic as a dermatologist, I'm allowed to use things that go slightly deeper into the skin, and I can kind of try to mix up treatments a little bit. But also beauticians can do some of those treatments to a kind of lower level in the skin, but she might find some of these treatments really beneficial. And what I love about microneedling, I do microneedling a couple of times a year, and I love it for the regeneration that it gives your skin, the cell turnover, it kind of gives you that glow. But what it's brilliant for with acne scarring, it's not like one of those treatments you have to go and invest time and time again. So for acne scarring, you'll do 3 or 4 treatments and you're done. So you'll have that plumping, the loss of the rolling, the loss of the kind of, little box scars and things like that in the skin. And you get that benefit, which then remains in the skin.
Fantastic, really interesting information. I hope that helped who asked that question. Moving on, are Avène, is that the company, and La Roche-Posay? Would you recommend those ranges?
Yeah, so look, these are what we always call the kind of French pharmaceutical brands, okay? I've worked as an independent advisor, and I fiercely hold on to the word independent because I'm a pretty no-nonsense dermatologist. And if I'm
We
not
love that.
in agreement with something that they're doing, I'll be like, no, 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 no. So what you tend to get with these products, they are ranges of products which have been developed for people with really difficult skin. And as a dermatologist, sometimes when you're sat in clinic, you've got people coming to see you with really bad problems. And what you don't want to do is to add something into their skincare regime that's going to cause chaos. And what I would say about those products is they're very reliable. They've got good science behind them. They've got good quality ingredients, and they really do their best to try to remove things that might be irritable to people's skin. And, I think that both companies are fantastic. Bioderma is another example of this. And I will often have patients come to see me. They've had a big reaction. So they've actually gone for some of those brands to try to find something calming and soothing. And they're good. They're good products. They're very committed to skin research. And over the years, so more recently, I've been working with L'Oreal over the cancer field, so for men and women going through chemotherapy treatments. And we've developed a whole range of products to help support patients through that, and also just to kind of help people feeling positive about their skin. And it's amazing because even doing those simple steps like cleansing correctly, moisturizing, and using sun protection, it can even help people having chemotherapy treatments and help them tolerate those things better with fewer skin side effects. So I can't kind of overestimate enough how important it is to get those pillars right.
Yes, and stick to the products that work rather than changing for the latest, glossy looking product, as you said earlier. Yes, wonderful.
So the key is just don't get sucked in by the hype. It's a multi-billion-dollar, kind of, it's an industry. Okay, so what you don't want to do is to get sucked into that latest celebrity endorsement. What you want to remember is, I want to know the science behind it, and I also want something that's not going to upset my skin. So you've got to be really open-minded to kind of getting those ingredients right and sticking with them when they work for you.
Fantastic. So someone just asked, I have CLL do I have to be extra careful of skin cancers, please?
Yeah, so again, this is kind of an area I've always worked in. So in terms of the prevention of skin cancers, so when you have a slightly low immune system or an immune system which isn't working in tip-top shape, the problem is that you end up with a slightly higher risk of things like skin cancers. So if we think back to that picture I showed where you saw how many cells are kind of constantly running around your skin, so usually there's this kind of daily surveillance that goes on in your skin where all of these immune cells are ready to gobble up cells that might be misbehaving or expressing mutations that might then cause a skin cancer. The problem is, if you've been very unwell, if you're on chemotherapy, if you're on tablets that lower your immune system, or if you have chronic conditions like CLL, which put you at a slightly lower immune system, a little bit more vulnerable to infection, these are situations where sometimes those little cells can sneak out of it and they don't get picked up by the surveillance that's happening. So we often say to patients, be much, much more cautious, make sure that you are brilliant with your sun protection and also be very vigilant with your skin. And for most patients in that sort of, with that sort of diagnosis, really, they should be having a once a year check. Now, I know at the moment with the NHS, it's so hard. But, you know, if you've found something on your skin you're worried about, you must take it seriously. Pop straight to your GP. You know, I ran a skin cancer service in the NHS for 10 years. The services are up and running and patients will be seen. So be really vigilant. Make sure when you're speaking to professionals that they know about your slightly higher risk and make sure that you're being proactive about getting these things checked.
Wonderful. Thank you. So you've got time for maybe one more question. Can you mix all active ingredients or is there a maximum you can use?
Okay, so we never like physically mixing things, okay? Because the problem is, if you think about it, all of these products can interact with one another. So you don't want to have a kind of chemical reaction going in with what you're mixing so that you're losing the efficacy of some of those ingredients. Yeah. So I'm a firm believer in keeping things really simple and having a benefit with, you know, one or two products. So don't overcomplicate it. So in terms of when you're younger, so when you're in your 20s and 30s, and I'll get lots of patients coming in saying, I'm worried about aging, Catherine. And I'm sort of looking at them going, oh my goodness, how can you be worried about aging now? But really what they need to be thinking about is their sun protection and thinking about adding in an antioxidant. And that would go in the morning. Okay, so antioxidant always in the morning, and then you put your sunscreen on. And then the kind of next step that you're reaching for as the skin gets a little older and fine lines become more of an issue and also defined lines, then we want to look for a retinol, okay, if you can tolerate it. So a retinol would generally go on at nighttime. So that way you're not needing to mix your products. You're not needing to complicate things. Yeah. What you'll often hear dermatologists talking about, some of these, particularly the retinols, can be irritable for the skin. They kind of create a little bit of dryness and irritation. So I'll often tell people in terms of ordering your skincare, you do a cleanse and remove makeup. And then you put your moisturizer and you wait for just a few minutes and then you put your retinol on. So what happens is that moisturizer, it's acting like a little bit of a buffer and it stops all the retinol from sort of suddenly attacking your skin. It will eke through the moisturizer as the night goes on. Yes. And when you're up and running with it and you're fine, you don't need to always do that moisturize first step, but it's a really, really good trick to kind of getting more used to products. Now, the other thing to say, if you're very savvy with your skincare, and it's certainly, I love a bargain, right? So if you actually get your sun protection right, you can often find that sun protection will have an antioxidant mixed in with their product. So that saves you having to splurge on a vitamin C as well. The reason why antioxidants are often added into sun protection is that as well as having that direct DNA damage that happens from UV exposure, you get this secondary damage that happens from something called reactive oxygen species. So you get the kind of the UV damage, and then you get the activation of all of these reactive species that go around and buzz around in the skin, doing huge amounts of damage to cells. And this is where the antioxidants come into play. So most sunscreens now, if you have a little look at their ingredients, they will have a kind of mixture. So they'll have all of those protections that we talked about and an antioxidant. And then that's one product in the morning and you're done. That's kind of magic. It's music.
That sounds like magic, one product in the morning. Yes. Yeah. Fantastic. There are so many more questions and we could probably go on for another half an hour, but I think from what I understand, Catherine, the link that is in the chat, which Ben can put in again, people can fill in the form and they can speak to you and you can maybe guide them towards the one product and offer a little bit of advice.
Yeah, exactly. So give me on that little form, we tried to kind of come up with a few key questions about major skin concerns or whatever. So if I have in a nutshell what you're really struggling with, and then in the kind of bits that you're able to fill in, if you can give me an idea of what you're doing at the moment, what is and isn't working for you, I'd be very happy to put together something personalized for you. And yeah, my team will be in touch then and we'll hopefully get things delivered out to you.
Amazing. What a fantastic opportunity. I hope everyone enjoyed that. And Dr. Catherine, thank you so much. That was utterly fascinating. And Dr. Catherine also has a wonderful article about dermatitis and eczema in our Goldster magazine. So if you subscribe to our newsletter, you will have that from last weekend. So yes, and I'm sure we can put it in the chat as well for those who want to link to it. Wonderful. Thank you, Dr. Catherine, and look forward to seeing you again soon. Thanks so much.
Yes, it would be a pleasure. Have a great afternoon.
Thank you so much.